The Central East Community Care Access Center has been providing centralized diabetes intake for the Center for Complex Diabetes Care since August of 2012. Recently, we've expanded the service to extend to diabetes education programs across the Central East Local Health Integration Network. Centralized diabetes intake allows for streamlined access to both community and hospital-based diabetes education programs, as well as the Central East Center for Complex Diabetes Care. Primary care providers, specialists, allied health professionals, patients, and caregivers have more streamlined access to these diabetes services, with one number to call and one referral form to use in the region.
More than 50% of the patients presenting to emergency departments in Scarborough are having diabetes as a co-condition, and that is a huge issue and challenge. Because the silo nature of our practices, and we don't communicate what we have or what we don't have, therefore we have a lot of gaps and duplications. If we all come together, catalog the services we have, and work together in a coordinated fashion, the system can be more efficient. Efficiency will result in better care, better access for the patient. This new centralized diabetic intake, which is available to all of us now, give you a new option. Patients may call themselves, the caregivers may call themselves, and during the process they may discover what other available services that may otherwise be unknown to them, such as Meals on Wheels, transportation, other social programs.
Within the community, we are mandated to see adult patients with diabetes. We see patients at risk of diabetes with pre-diabetes, patients who are on low-dose medications to upper-dose medications, as well as patients who are on insulin. There's different education levels, there's different learning needs amongst our patient population as well, and we recognize that. Any patients that are elderly need a little bit more care. Any patients have language barriers. As I mentioned, the team speaks 14 different languages. And we're also working very closely with the CCAC within the Central East LHIN to really standardize a centralized intake and a centralized intake referral process. It's taking out a number of different steps that are being used right now and just really aligning that patient to the best resource. You can really see the strength in bringing all the different programs within the Central East LHIN, breaking down those silos to better address the patient and better get the patient what they need and have that continuum of care with all the healthcare professionals that are involved in their circle of care.
My doctor recommended me to come to these classes so I don't end up a diabetic like the rest of my family. It's been quite educational and enjoyable. The staff is excellent here, and they're good teachers. And they're easy to talk to, and they have answers for all your questions. They have for all of mine anyway. No, I'm really glad I come to this because it's been very, very helpful, and I'm going to use it in the future.
As a dietitian, I think it's really important to have food models. So that's, in a way, that's more like a visual resource so that they can actually see what 1 cup of rice looks like, or 1 cup of noodles looks like, or 1 medium-sized fruit.
We talk about what is diabetes. So what type of diabetes, for example, type 1, type 2 gestational diabetes, and also how the diabetes, like a progressive disease, or what are some of the myths about diabetes. When the patient come into one-on-one or group, usually I ask them what do they want to know, what they want to achieve. So from that, then I usually guide them.
So a hospital-based diabetes education program differs a little bit from a community-based diabetes education program in that the type of clients that are referred to us are sometimes just a little bit more complex. We also see women with type 2 diabetes who are pregnant or planning a pregnancy, and we would see women who have gestational diabetes, so that's the type of diabetes that develops during pregnancy. There are many different services that we provide the client once they're referred here. If they're referred, they may see an endocrinologist who is a doctor, who is specifically a doctor for someone living with diabetes. It's all about self-management. It's all about helping that client better self-manage and manage their whole life, not only just living with diabetes.
The Center for Complex Diabetes Care, or CCDC, is for those patients living with complex diabetes. These are patients who require more contact, more follow-up, and more resources across the health and social services systems. And access to the CCDC is through the Centralized Diabetes Intake.
So the Center for Complex Diabetes Care is somewhat different from other diabetes centers in that our clients do have a complexity. They have other medical comorbidities, so a heavy burden of illness, as well as a lot of times mental health issues, poverty issues, basically everything that impacts your ability to care for yourself when you have a chronic illness. And I'm always impressed that they always put their best foot forward and they actually come in and we get together and come up with a plan.
Really my main role, probably half to about 3/4 of what I do here is looking after the medication, speaking with the patient about the medication, what they're used for, because education is such a big part of not just diabetes care, but healthcare in general. I work with a nurse practitioner, a social worker, a dietitian, and a registered nurse. Really, we're moving forward together as a whole team and with the patient as well.
I found out about the CCDC while I was attending the Diabetes Education Center here at the hospital. They recommended that I go there for a little bit extra assistance with my diabetes care. All of the team members that are in the CCDC have helped me quite a bit. I'm new to the pump and they showed me how to effectively use the pump, and I've gotten recommendations from them for other services and stuff like that. So they have helped me out quite a bit, and I believe that my diabetes is very much more effectively looked after.
Access to Centralized Diabetes Intake is through the Central East Community Care Access Center. The Centralized Diabetes Intake Care Coordinators have specialized knowledge, skills, and ability relating to diabetes. Based on information obtained from the referral form, as well as the phone call with the patient, the Centralized Diabetes Intake Care Coordinator determines eligibility for numerous services, including diabetes education programs, Central East Center for Complex Diabetes Care, the Regional Cardiovascular Rehabilitation and Secondary Prevention Program, Community Care Access Center Services, Community Support Services, Healthcare Connects, and the Central East LHIN Self-Management Program. With Centralized Diabetes Intake, healthcare providers and patients no longer have to determine who is appropriate for diabetes education programs and who is appropriate for the Center for Complex Diabetes Care. Instead, the Centralized Diabetes Intake Care Coordinator makes this determination. The Centralized Diabetes Intake Care Coordinator provides the patient with options based on their own unique needs and preferences. The patient then determines which location they wish to attend.